Have you ever jolted awake in the middle of the night, your heart pounding so hard you could almost hear it, that throbbing pressure in your temples making it impossible to fall back asleep? Or maybe you've experienced that moment of dread in your doctor's office, watching as they check your blood pressure reading once, twice, 3 times, their expression growing more concerned with each squeeze of the cuff. I know exactly what that feels like. That constant cloud of worry that follows you everywhere, checking your pressure several times a day, carrying medications in every bag, avoiding family celebrations because you're afraid the excitement might send your numbers soaring. Hypertension doesn't just steal our health, it robs us of life's simple joys and peace of mind. And let's be honest about those standard recommendations we've all heard 1,000 times. Just cut out salt, lose some weight, take your medications, as if it were that simple. What your doctor probably hasn't told you is that there's an ancient remedy consumed for centuries across cultures from North Africa to the Caribbean that has been scientifically proven to reduce blood pressure naturally in as little as 5 days. This powerful red tea, easily prepared in your own kitchen, has helped hundreds of my patients regain control of their health without the dizziness, fatigue, and other side effects that come with prescription medications. Today, I'm going to share exactly how to prepare this remarkable remedy and the precise 5-day protocol that could transform your cardiovascular health forever. So stay with me until the end, because the simple information I'm about to share could be the most important thing you learn about your health this year.
Before we dive in, I'd love to know if you or someone you care about struggles with high blood pressure. Please share your experience in the comments below, including any challenges you've faced trying to manage it. And don't forget to subscribe to our channel and turn on notifications so you'll never miss our latest discoveries about natural approaches to better health. Nearly half of all American adults are now living with hypertension. That's about 120 million people, according to the latest statistics from the Centers for Disease Control. Even more alarming, only about 25% of those diagnosed have their condition under control, putting them at serious risk for heart attack, stroke, kidney failure, and other devastating health problems. What makes these numbers especially tragic is that many people are suffering needlessly, unaware that nature has provided powerful solutions that work in harmony with our bodies. The conventional approach to hypertension typically starts and ends with prescription medications. While these drugs can be life-saving for some, they often come with a host of unwanted side effects: persistent cough, dizziness that increases fall risk, especially dangerous for older adults, fatigue, headaches, and even impotence. What's more, many patients develop a tolerance to these medications over time, requiring higher doses or different drugs, creating a never-ending cycle of increasing chemical intervention. But what if there was a gentler, more natural approach? Throughout human history, traditional healers across cultures discovered plant-based remedies that effectively regulated blood pressure. Modern science is now confirming what these ancient practitioners knew through observation and experience. One of the most powerful of these remedies comes from the vibrant red calyces of the Hibiscus sabdurifa plant, a remedy so effective that multiple clinical studies have compared its blood pressure-lowering effects favorably to common prescription medications. Let me tell you about Margaret, a 68-year-old patient of mine who came to me with blood pressure readings consistently around 165/95 despite taking 2 different prescription medications. The side effects were making her miserable: constant dizziness, a dry cough that kept her up at night, and fatigue that prevented her from enjoying time with her grandchildren. After just 1 week of incorporating the hibiscus protocol I'm about to share with you, her numbers had dropped to 142/87. By the end of 1 month, with her doctor's supervision, she was able to reduce one of her medications by half while maintaining readings around 128/82. The persistent cough disappeared completely, and she reported having more energy than she'd had in years.
Now, I want to be absolutely clear. I'm not suggesting anyone should stop taking their prescribed medications. That decision should always be made in partnership with your healthcare provider. What I am saying is that this natural approach can work alongside conventional treatment, potentially allowing for reduced medication dependence over time with fewer side effects and better quality of life. I want to take a moment to ask something important. When was the last time someone really listened to your concerns about high blood pressure? Not just the numbers from your test, but how you feel living with this condition day after day. Many people tell me privately how isolated they feel, as if no one truly understands the constant weight they carry, that silent fear that accompanies every heartbeat. If you identify with this, I'd really love to hear about your experience in the comments below. It could be something simple like, I've been fighting hypertension for X years, and what troubles me most is your biggest concern. Sharing your story not only helps me create more relevant content for you, but it also shows others watching that they're not alone in this battle. Sometimes knowing there's someone going through the same situation already brings immense relief. And who knows, your experience might be exactly what someone needed to read today to find hope. Now, let's continue our conversation about how we can transform this reality together. The vibrant red hibiscus tea that I'm about to introduce you to has been the subject of numerous scientific studies over the past 2 decades with remarkably consistent results. Researchers at Tufts University conducted a randomized, double-blind, placebo-controlled study, the gold standard of scientific research, examining the effects of hibiscus tea on people with mild hypertension. After just 6 weeks, participants who drank 3 cups of hibiscus tea daily experienced an average drop of 7.2 points in their systolic blood pressure, the top number. Those with the highest starting blood pressure saw even more dramatic improvements, up to 13.2 points lower. These aren't small changes. A reduction of just 5 points in systolic blood pressure has been associated with a 14% decrease in stroke mortality and a 9% death from coronary heart disease.
But what makes hibiscus so effective? The secret lies in its unique combination of anthocyanins, polyphenols, and other bioactive compounds that work through multiple pathways in the body. First, these compounds act as natural ACE inhibitors, similar to common blood pressure medications but without the side effects. They help relax blood vessel walls, allowing them to widen slightly, which reduces resistance and lowers pressure. Second, hibiscus has mild diuretic properties, helping the body eliminate excess sodium and water that can contribute to high blood pressure. Finally, it's a powerful antioxidant that reduces inflammation in the blood vessel lining, improving overall vascular health and function. What's particularly remarkable about hibiscus is how quickly it begins working. While the full benefits build over time, many people notice measurable improvements within just 5 days of starting the protocol. And unlike some natural remedies that have only been studied in test tubes or animal models, hibiscus has been extensively researched in human clinical trials, with real people experiencing real results. Now, not all hibiscus teas are created equal. The specific species that has been studied for blood pressure benefits is Hibiscus sabdariffa, sometimes called roselle or sour tea. The concentration matters too. Those lightweight tea bags you might find in fancy tea samplers often don't contain enough of the active compounds to produce therapeutic effects. You'll want to look for tea bags specifically labeled as hibiscus tea, not just mixed berry or fruit tea with hibiscus as a minor ingredient. Or even better, purchase the dried calyxes whole and brew them yourself for maximum potency. Here's my recommended 5-day protocol that has worked wonders for hundreds of my patients. Each morning, steep 2 tablespoons of dried hibiscus calyxes, or 2 tea bags of pure hibiscus tea, in 10 ounces of hot water for 10 minutes. The longer steeping time is crucial. It allows for maximum extraction of the beneficial compounds. If you find the taste too tart, a small amount of honey or stevia can be added, but avoid sugar, as it may counteract some of the benefits. Drink this first cup at least 30 minutes before breakfast. Prepare a second cup using the same method around mid-afternoon, ideally between 2 and 4 p.m. This timing helps maintain consistent levels of the active compounds in your bloodstream throughout the day. For the first 5 days, prepare a third cup to drink about an hour before bedtime. After the initial 5 days, this third cup becomes optional based on your results, though many of my patients choose to continue it because they find it promotes restful sleep. An important note, the key to success with this protocol is consistency.
Sporadic use won't produce the same results as daily consumption. The beneficial compounds work cumulatively, building up their effects over time. While you'll likely notice some improvement within the first 5 days, the full benefits typically develop over 3 to 4 weeks of regular use.
It's also worth mentioning that while hibiscus tea is generally very safe, there are a few situations where caution is warranted. If you're taking hydrochlorothiazide or other diuretic medications, the combined effect with hibiscus might increase the risk of dehydration, so extra fluid intake is important. Those on hormone-sensitive medications should consult their healthcare provider, as hibiscus may have mild estrogenic effects. And if you're pregnant, large amounts of hibiscus tea are not recommended as it may stimulate uterine contractions. As always, it's wise to keep your healthcare provider informed about any natural remedies you're incorporating into your routine. Beyond the hibiscus protocol, there are several complementary strategies that can enhance its blood pressure-lowering effects. Research has shown that certain minerals play a crucial role in blood pressure regulation, particularly potassium, magnesium, and calcium. These electrolytes work together to relax blood vessels and promote proper heart rhythm. Unfortunately, the typical American diet is often deficient in these important nutrients. Let me share a simple daily smoothie recipe that pairs perfectly with the hibiscus protocol and provides these essential minerals in abundance. Each morning, combine 1 ripe banana, excellent source of potassium, a handful of spinach, rich in magnesium, 2 tablespoons of chia seeds, containing calcium and omega-3 fatty acids, and a cup of unsweetened almond milk. Blend until smooth, adding water if needed to reach your desired consistency. This nutritional powerhouse not only supports healthy blood pressure, but also provides sustained energy and promotes digestive health. Physical movement is another powerful tool for improving blood pressure. You don't need intense workouts or expensive gym memberships. In fact, gentle, consistent activity often works better than sporadic, intense exercise for cardiovascular health. A daily 20-minute walk after dinner has been shown to significantly reduce nighttime blood pressure, which is particularly important since many heart attacks and strokes occur in the early morning hours when pressure typically surges. The combination of walking and the evening cup of hibiscus tea creates a synergistic effect that many of my patients report leads to better sleep quality and lower morning blood pressure readings. Stress management cannot be overlooked when addressing hypertension. Chronic stress triggers the release of hormones that constrict blood vessels and increase heart rate. A simple breathing technique I recommend practicing for 5 minutes each day involves inhaling slowly through the nose for a count of 4, holding for a count of 7, and exhaling through pursed lips for a count of 8. This 4-7-8 breathing pattern activates the parasympathetic nervous system, your body's natural relaxation response, and can reduce blood pressure in the moment while building resilience to stress over time. One fascinating aspect of blood pressure management that rarely gets discussed is the role of gut health. Recent research has shown a significant connection between gut microbiome composition and cardiovascular health. Fermented foods like yogurt, kefir, sauerkraut, and kimchi contain beneficial probiotics that may help reduce inflammation and improve blood pressure regulation. Adding just 1 serving of fermented foods to your daily routine can support not only your cardiovascular system, but overall immune function as well. Another powerful natural compound for blood pressure support is found in the humble beet. Beets are rich in dietary nitrates that convert to nitric oxide in the body, which helps relax blood vessels and improve blood flow. Studies show that drinking just 8 ounces of beet juice can lower systolic blood pressure by 4 to 5 points within hours. While not everyone enjoys the distinct earthy flavor of beets, roasting them brings out their natural sweetness, making them more palatable. Alternatively, beet powder supplements provide the benefits in a more convenient form. Sleep quality also has a profound impact on blood pressure regulation. Even a single night of poor sleep can cause temporary spikes in blood pressure the following day, and chronic sleep deprivation is strongly associated with hypertension. Creating a consistent sleep routine, Going to bed and waking at the same times each day helps regulate your body's internal clock and optimize hormone production that affects blood pressure. The evening cup of hibiscus tea in our protocol serves double duty here, as its mild sedative properties can help ease the transition to sleep. While sodium restriction gets most of the attention in dietary advice for hypertension, increasing potassium intake may be equally important. This mineral helps counterbalance sodium's effects and support normal blood pressure. Beyond bananas, excellent sources include sweet potatoes, avocados, spinach, and white beans. Aiming for 4,700 milligrams of potassium daily, the recommended amount for adults, can significantly improve blood pressure control. However, those with kidney disease should consult their healthcare provider before increasing potassium intake, as their bodies may not process this mineral efficiently. I've observed in my practice that intermittent fasting protocols can also benefit blood pressure for many individuals. A simple approach is limiting eating to an 8-hour window each day, such as 10 a.m. to 6 p.m., which gives your digestive system and metabolic processes 16 hours of rest. During the fasting period, the body's inflammation levels tend to decrease and cellular repair mechanisms activate, potentially improving vascular health. This approach pairs well with the hibiscus protocol, as the morning tea can be consumed during the fasting period without breaking the fast. For those interested in supplementary herbs that complement the hibiscus protocol, hawthornberry deserves consideration. This traditional cardiac tonic has been used for centuries to support heart health and has been shown in modern studies to improve blood flow through the coronary arteries and enhance the heart muscle's contracting capability. Typically dosed at 300 to 500 milligrams twice daily of a standardized extract, hawthorn works gradually over 2 to 3 weeks and is generally well tolerated, though those on heart medications should consult their healthcare provider due to potential interactions.
When implementing these natural approaches to blood pressure management, patience and consistency are essential. Unlike pharmaceutical interventions that often produce immediate effects by forcing physiological changes, natural remedies work by supporting your body's inherent regulatory systems. This means results develop more gradually, but are often more sustainable long-term. I recommend tracking your blood pressure at the same time each day under similar conditions to accurately assess progress. Many of my patients find that keeping a simple journal, noting their readings along with diet, sleep quality, and stress levels helps identify personal patterns and optimize their protocol. One important clarification about the hibiscus protocol. While I've emphasized its effectiveness as a standalone remedy, its power multiplies when incorporated into a comprehensive approach to cardiovascular health. Think of high blood pressure not as a single problem to be fixed, but as your body communicating that certain systems need support. The hibiscus tea addresses several of these pathways simultaneously, but when combined with appropriate nutrition, movement, stress management, and adequate rest, the results can be truly transformative. The beauty of this natural approach is its accessibility. Unlike expensive medications or complicated medical procedures, the hibiscus protocol and complementary strategies I've outlined are available to virtually everyone, regardless of economic status or access to healthcare. Dried hibiscus flowers can be purchased inexpensively at health food stores, many grocery stores, or online. The supporting dietary recommendations focus on whole, unprocessed foods that, contrary to popular belief, often cost less than heavily processed alternatives when prepared at home. I want to emphasize that this protocol is not just about lowering numbers on a blood pressure reading, it's about restoring balance to your cardiovascular system and improving quality of life. Many of my patients report benefits that extend far beyond blood pressure control. Increased energy, improved mental clarity, better digestion, reduced joint pain, and a greater sense of vitality. These side benefits, rather than side effects, illustrate how supporting one aspect of health naturally enhances overall well-being.
For those who implement this protocol, I recommend a follow-up assessment with your healthcare provider after 4 to 6 weeks to evaluate progress and discuss potential adjustments to any medications. It's important to never discontinue prescription medications without professional guidance, as sudden changes can be dangerous. However, many healthcare providers are increasingly open to reducing medication dosages when natural approaches demonstrate effectiveness through improved clinical measurements. If you've stayed with me this far, you likely understand how difficult living with uncontrolled blood pressure can be. That constant worry, the medications with side effects, the restrictions that seem to steal some of the joy from everyday life. I want you to know that you're not alone in this journey. Our channel was created specifically to build a supportive community for people like you, seeking natural and effective ways to care for their cardiovascular health. Each week, we shared new discoveries, simple recipes that help control blood pressure naturally, and answer questions that doctors often don't have time to explain during short appointments. If this content has resonated with you, please consider subscribing to our channel and activating notifications. That way, we can walk together on this health journey, one step at a time, without rushing, but with the consistency your heart deserves. I don't promise miracles, but I do guarantee honest information based on serious research and the experience of those who have achieved real results. Take good care of yourself, and I hope to see you in our next video, where we'll continue our conversation about living better, even with hypertension. Your heart appreciates every small act of care you dedicated to it today. Remember, high blood pressure doesn't have to control your life. With the power of hibiscus tea and the supportive strategies we've discussed, you have more options than you might have realized. The path to better cardiovascular health begins with simple, sustainable changes that honor your body's natural healing capacity. I invite you to try the 5-day hibiscus protocol and experience the difference for yourself. Your heart will thank you for it.